Hi, it's Anita Coleman from Dr. Coleman's office, and I'd like to share some activities with you that your baby will enjoy and find helpful after a frenotomy release. One of them is a gentle facial massage where you would lightly stroke the skin of the baby's face. It'll activate cranial nerves 5 and 7 to help them coordinate with their new movement, and it feels wonderful and it's very relaxing. So a couple times a day, when what I call playtime, let your baby enjoy that. The other thing you can do if they have tight lips is to do a gentle massage around the lips, stroking the smile lines. It'll help the baby let go of some of the tightness that they feel. Many times a baby at the breast will go like this and be a good latch with the nipple going toward the soft palate, the lips very soft, and the tongue undulating. But if they have oral ties, this position hurts them, so they slide down to the end, chomp, 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 and you can see the lips are so tight and air can come in on the sides, giving the baby gassy troubles. So by massaging the lips, you're telling those muscles to relax and it helps the baby. One of the sucking exercises, if your baby has a tongue tie, is to massage the lower gums. So you come in and stroke around the gums. The baby has a reflex under 2 or 3 months of age where their tongue will follow your finger. And for the baby after frenotomy, it becomes 1, 2, 1, 2, 1, 2, helping the tongue get a little stronger and stretching laterally a little more, which helps them with function. So again, this is during playtime, a couple times a day. Therapeutic intentional tummy time is very important for a baby after frenotomy and before because it helps the baby balance and prepare for crawling, integrating infant reflexes. So a baby will integrate half of the infant reflexes on the back and half on the tummy. So you need to get them in therapeutic intentional tummy time nowadays with babies sleeping on their backs. So babies that have an opportunity to do tummy time, then after the procedure, we recommend 5 times a day, starting at about 5 minutes. And if you lay the baby on their back and then tuck one arm and roll them into tummy time, hands out like this, then if they get fussy, tuck the arm and roll them out of tummy time and talk to their little face. So you roll into tummy time and roll out, roll in and roll out for them to feel happy. You just don't want them going to kindergarten, 1st or 2nd grade with non-integrated infant reflexes. So being on their tummy helps them integrate all of them. Another thing we recommend is closed mouth at rest. Healthy humans sleep best when their tongue is suctioned to the roof of the mouth. The mouth is closed gently and they breathe through the nose. Many babies with tongue ties, though, they can't get their tongue up that high. The palate becomes too tall. So if you see your baby with an open mouth breathing posture while they're resting in your arms, you just lift the chin, lower the lip, and let them breathe through their nose for 60 seconds. And 60 seconds is long when you're counting it. Then let go and see what happens. If, oh, popped open again, you're going to do it again, and you may need to work on that for a week or 2. But what you want to do after that is lower the skin of the chin and look that the tongue is up. If it's not, if it's hanging low, you can massage underneath here in the soft area, aiming toward the tip of the head, not back toward the trachea or not toward the chin, just straight up. You can use a thumb as well. It'll annoy the baby a bit and they'll lift their tongue to get it out of the way of that pressure. Then try again. And you may need to do that a couple of times. Then you can do the sleeping tongue posture hold. And I put on your paper, see YouTube, because you'll be able to watch a demonstration. It looks like this, even while the baby's at rest. You can see how it's stretching my frenulum. and staying up tall. If you can help your baby have a closed mouth at resting time, they will grow up much healthier with good nasal breathing, which gives them nitric oxide in their bloodstream and the air is conditioned. Babies who breathe through their mouth aggravate adenoids and tonsils, and they grow up snoring and potential sleep apnea. So you have a great opportunity to help them in this regard. Well, I'll talk to you a little bit more when I see you in person, but I hope these little tidbits help you.